Hi everybody, I'm back. We are here to talk about lip fillers today. So, I have been doing lip fillers for, 10 years or so. And it's an evolution of a process, I'm going to say. There was trends, there's a certain way I was taught to do it, and then after I've done so many, I thought maybe tweak it a bit here, tweak it a bit there. I've modified my technique. I've gone through phases of using cannula, needles, both depending on, shape and volume and what is desired. And so basically I'll just talk you through the principles of lip augmentation. Essentially, with the lip, you can change the actual shape of the lip a little bit, but you shouldn't do that. Essentially, you should maintain the natural shape of the lip, but you can enhance it in 3 different ways. The first thing you can offer, or you can do, is what we call contouring of the lip, where essentially you follow that line, which we call the vermilion border, essentially, which is the junction between the pink of the lip and the skin, essentially. So you go along, it's like a modified lip liner pencil, essentially. Sorry, I look like I have a mustache, but that's my, I put some numbing cream on before I started this video, and that's why I look a bit funny. But hey, never mind the mustache. So essentially what you do with the contouring is you simply enhance the outline of the lip. Not everybody needs contouring of the lip. The contouring of the lip is more for clients who want to demarcate the junction between the skin and the lips a little bit more, possibly make them a tiny little bit more prominent. It is very, very, very good if you are unfortunate to have these little lines that traverse from the upper lip down. They call them smoker's lines. In my opinion, they're absolutely unrelated to smoking. The vast majority of my clients who do have these lines are non-smokers, lifelong non-smokers. Of course, smokers do get them as well, who knows. They're a bit annoying, these little lines, mainly because if you like to put makeup on or lipstick on, it tends to make lipstick bleed. So the ideal solution is to do contouring of the lip, and that works a treat for that. The second option, so we talked about contouring, the second option is what we call volumization of the lips. So you maintain the shape of the lips, but what you then do is you just make them a little bit more voluminous. Whether it's the lower lip or the upper lip or both is up to the client, obviously, and the person treating. The third possible option is eversion of the lip. So some people have an inverted lip, basically, where it is going inwards. And then the idea would be to evert it outwards, to make it go outwards a little bit. I do that, but I'm quite cautious about the amounts I inject, I must say. The reason is I personally severely dislike that ducky lip that some people seem to like. It's a lot on social media and people are all over it at the minute, where the thingy, this is not for me. I don't like it. I think it looks very unnatural and weird, and so yes, it is an option. So some clients benefit from it, especially patients or clients who have an inverted lip where it's going inwards. So yes, they would benefit for, you can volumize the lip as much as you like, but if it's showing inward, nobody's going to see the lip. In fact, you really risk it looking very weird and funny. So the idea is to basically evert it. So these are the options. Now, with regards to fillers, I have tried probably everything that's on the market. So of course my number one product is at the minute, and I think will always be, Juvederm. The brand is just superior to other brands, in my opinion, for a variety of reasons. The first of them is the feel. It very, very quickly gels into the connective tissue of the lips and therefore becomes part of your lip. you don't tend to, with Juvederm, get this funny feeling of having a foreign solid body in there at all. Yes, for the first week or so, sure, you do get this funny feeling there's something weird there. Absolutely. But afterwards, what tends to happen is things settle down massively. It integrates into your tissue. It feels very normal, and it just gels into your tissue. Satisfaction, client satisfaction with Juvederm is far higher than with any other product. Now, there are the odd clients that actually like the non-natural feel to the lips. You can use other things for these clients. I would use Teosyl or Restylane, depending. But it's not the common asked for thing, basically. Commonly, patients do request to have the natural feel and not the synthetic feel. The other reason I prefer Juvederm is the incidence of granuloma. That's a possible complication of all fillers, but the incidence is particularly low with Juvederm. And the third thing is really lumpiness, which some people experience using other fillers. I think it's injector dependent, the lumpiness, but in my experience, again, with Juvederm, it is less of an issue than with any other filler. Now, it's a little bit more expensive than other fillers, but hey hum, it's a superior product in my opinion, and they deserve to be more expensive, if that makes sense. There's kinds of Juvederm. For example, in the Juvederm Ultra range, there's a Juvederm Ultra 2, Juvederm Ultra 3, Juvederm Ultra 4. Now, 2 is good if you're just treating these tiny little lines that are going across. But for actual lip enhancement, you do need something a little bit less of a liquid gel, more of a solid gel, if that makes sense. So Juvederm Ultra 3 would be the ideal. However, Juvederm Ultra 4 isn't really ideal for lips, except in very few cases. It's a very solid gel, and I'd much more use Juvederm Ultra 4 for example, cheek augmentation or really deep nasolabial folds or something like that. But I wouldn't really use it for the lips. I wouldn't recommend it at all. Vast majority would benefit from Juvederm Ultra 3. Yes, and then pain relief. Yes, very important. I do not do lips unless I have given somebody a dental block. I refuse to do it under, some people do it with the cream or whatever. The only reason I have the cream on today is I have purchased a new kind of cream and I wanted to try it out. Literally, that's it. But I would not dream of doing lips without proper local anesthetic. So what I do is I do a dental block. I use lignocaine hydrochloride, basically. So what I'm using today is a 2%. And I inject it into 4 areas, basically. And that just makes the whole lip area numb for approximately 30 minutes to maybe 45 minutes. That is good because that is more than enough time for me to do the treatment, finish up, and by the time the feeling comes back, you know, it's okay. Everything is sorted, everything is done. The other massive thing that I swear on is icing of the lips. So I would ice my client's lips for a minimum of 5 to 10 minutes before we start the procedure, and then for another at least half an hour to an hour after the procedure. Okay? In my opinion, it makes a huge difference in the incidence of bruising and swelling afterwards. And this leads us to the possible complications of lip fillers. Of course, they exist. Yes, there are complications of lip fillers. They're not to be taken lightly. It's very important to know about these. There are things that are not so severe or serious, which obviously include the bruising and the swelling. Yes, they happen. Yes, they're very annoying. And yes, it looks a little bit, but it all goes away. The average time is 4 to 7 days. You can bring it down by icing. You can bring it down to 2 to 3 days, sometimes 4 days. But it's a significant improvement in the incidence of swelling and bruising, like I said. The more severe complications include granuloma formation, which is, unfortunately, this can't be helped, this can't be prevented. If you're using a very good quality filler, like for example Juvederm, the incidence of that is much less. However, if you're using, I mean, you hear these horror stories about people injecting all sorts of random stuff into people's lips, and God knows where they get it, I don't know. But these unpure forms of hyaluronic acid, which is what Juvederm is, can cause a foreign body reaction. So your body reacts to it like it's well, of course it should react to it like it's a foreign body that's embedded itself into the lips. And therefore it starts, the body's immune system comes and attacks the filler in little lumps, essentially, that can cause horrible swelling and discharge, and it looks like an infection, but it's not actually an infection. It's the body reacting to the foreign material that is there. It's horrible. The only solution to treat that is really to dissolve the filler. The other possibilities, obviously infection can happen, so that's why you have to be very, very careful whenever you do get your lips done. You need to sterilize the lip area. Now the mouth is a problem because obviously it's a naturally dirty area, and people, unfortunately, it is very, very common, and I'm probably exactly the same. As soon as you have something done to your lips, you lick it. A human mouth is actually incredibly dirty. It is full of microorganisms and bacteria, and licking the lips is just, but what can you do, you know? So during the procedure, we're obviously very careful. We perform an aseptic technique. You wear gloves, you wipe the area with alcohol many times before you start the procedure. Obviously everything is sterile. But afterwards, a lot of patients tend to lick their lips, and I try to make patients conscious of this, to say, please, please, please don't lick your lips. It is, you know, possibly risky, etc. But, you know, yeah, we'll just have to see how people cope with this. Yeah, so the other complications are really rare, but they do include sort of occlusion of some of the blood vessels in the mouth area. It sounds freaky, and it can be freaky. Unfortunately, if you have a practitioner that's not very experienced, things can go quite wrong. However, if you have somebody who is experienced, first of all, they will really understand the anatomy of the blood vessels of the mouth, how the blood vessels go and where they go, and where to inject and where not to inject, because there's very important places where you just should not be going near because they can cause problems. If you block the blood supply to an area of the mouth, obviously the problem is, yeah, you know, these horrible pictures you see in the media where one area of the mouth goes black or something like that. This is terrible. However, don't worry. If you're going to somebody who's experienced, A, they will know where not to inject, but B, also they will have the solution to what to do if it does happen. If a blood vessel does get occluded, you need to dissolve the filler. Done. There is no argument about that. So there's this, so fillers are hyaluronic acid, and you can get an enzyme called hyaluronidase that dissolves the filler. It takes 30 to 60 seconds. It is fantastic. But every practitioner, so this is advice, this is really, really important. If you're ever going to get your lips done, you must be sure that the practitioner has hyaluronidase, the dissolving enzyme, there. If anything, God forbid, should happen, then it can be dissolved. No problem. What have you lost? Nothing. A few quid on filler. Okay, but you haven't lost the lip. Everything is safe. Everything's okay. No harm done. This is very important. Please, please, there's a lot of people out there who are not qualified doing fillers. Fillers everywhere can go wrong, anywhere, but the lips are just a very, very, very precious, highly vascular, high risk area. So I highly disagree with some people who are doing them at the minute. I don't know, so back when I trained, it was only either doctors, nurses, or dentists that were able to do these procedures. But it seems that the rules have relaxed a bit, and a lot of other people who are not necessarily qualified, have a good medical background or medical understanding, are allowed to do them. I personally would not risk it. That's one thing. Now, anyway, that aside, the chances of you having really, really lovely lips after this procedure are very high. The chances of anything going wrong or them looking not like you like it or whatever are relatively small. So I do encourage you to get the procedure done. It can give a lovely result if done well. For me, I strongly believe that less is more. I do not agree with patients who want to have, basically who have no lips and now all of a sudden want to go from 0 to hero, so to speak, where it's basically a massive increase in the volume. I usually stick to the moderate amount of 1 mil for the first session. I don't like to inject anymore. The exception to that would be if you have very big lips anyway, 1 mil will be not enough to cause a really good effect. But for example, if you have lips like mine, I would not recommend injecting anything more than 1 mil. It's not a good idea, no. If you've had this done before, if you've had your experience, if you've had 1 mil and then want to top up with another 0.5 mil, okay, then I might consider doing 1.5 mil at that session. But for starters, no more than 1 mil. Less is more, absolutely true and relevant. So that. Now you're gonna ask me, how did you get to injecting your own lips? Well, crazy, hey, innit? So I had a bad experience. It was about 11 years ago now, in 2009, but just before I was getting married. So essentially I was doing my fillers and Botox way before then, but I decided for my own wedding, I want to have my lips done. And I really don't want to do them myself. I had never done my lips at that stage myself. And I didn't want to do my lips myself just in case I mess it up. And I obviously didn't want to look, not okay for my wedding day, right? So I got them done by a lady I kind of knew of. I didn't personally know her, but she had a relatively good reputation. So off I went, got them done. Oh no, jeepers. So they were horrible. They were asymmetrical. This side was bigger than this side. There were 2 lumps just under the thing, basically under the lips, which I could feel. They annoyed me for months. And they were not the shape I wanted. They were nothing like what I wanted them to be, unfortunately. And I really and my wedding, I couldn't even smile properly because she did it in a way that covered the teeth when I smiled. I was really angry, not with her, but with myself, because I knew I should have done it myself, because I would have at least done what I wanted and what I thought is right. And I was also angry, obviously, because it was my wedding, and it's not exactly that you get married every, 2 years. And, it was anyway, fine, done. And then I was angry with myself because, you know what, I could have dissolved them. I could have done it all again myself. I didn't. I don't know why. I just thought, no, it'll settle before the wedding. It'll all settle. It'll all look fine. Well, it didn't. And then by the time I wanted to do it, it was way too close to the wedding time. So that obviously I didn't want to bruise and, Anyway, so then I thought, you know what? After about 6 months of having these awful lumps there, I was like, I'm going to just dissolve them. So I did. And the lips just went back down to normal size and shape. And then I was like, I really miss having filler lips now. So then, of course, enter idea of doing it myself, and I did, and it was absolutely fine. So I've been doing my own. I don't do my lips every 5 minutes. I do them maybe once every couple of years now. I've got to that stage, and I usually use 0.5 mil, possibly 1 mil if I haven't used anything for more than 2 years. So don't get me wrong, I don't like the look of looks, I don't. But I do think a little bit of enhancement done in the right way gives people just this added little bit of extra. Now, it depends obviously on your age. It's not like one technique or one way suits everybody. Absolutely not. What would suit a 25-year-old is certainly not what would suit a 65-year-old. Very different lips. I think a 65-year-old lady definitely shouldn't have big lips because that is just very unnatural. However, there's nothing wrong with having lovely contoured lips which don't bleed when they put the lipstick on. It's just a very different way of doing it. Anyway, so enough talk. I'm going to switch off now, and the next video is going to be the live demo of doing the lips. In the interim, I'm going to just freeze myself up. That's not something you have to see. I'm just going to inject a little bit of local anesthetic on the inside of the mouth, like that, into these 4 areas basically, to give myself numb lips. So when I come back to you, I will sound funny because I'm not going to be able to talk very well. I'm also going to spend about 5 minutes icing my lips, and then we will see you again.